I'm here in front of the Cardiac Institute in Havana. I've been speaking with family members of patients who are in here and also staff who work here. And we were speaking about how this ongoing oil blockade is impacting the health system here. I spoke with a elderly woman. Her husband is in the hospital right now, and she said the first thing they had to figure out when her husband started feeling fatigue and started worrying about his heart was how to get to the hospital, because transport is scarce, and when there is transport available, it's getting expensive. But once they got here, she said this hospital is working at about 50% of its staff capacity, that there's just less people who are providing the same level of service, even though they're still providing key services. She also says that they are only taking people who have urgent needs, elective issues. If they're not urgent and life-threatening, she says they're really having a hard time accepting anybody beyond that because they just don't have the capacity. I also spoke with a nurse and a lab technician who confirmed that yes, there are less people working at hospitals in Cuba, and one of the reasons is it's because of this economic crisis, because the salaries that doctors and nurses are paid are just not enough to get through. They're not enough to provide for families. Even though the health system is a point of pride for Cuba, it's something that they export to the rest of the world. Those within the health system aren't making enough right now because of this crisis, because of the impact it's had on the skyrocketing prices. It's just not enough for them to make ends meet. So people are quitting, medical staff are quitting to find other ways to make money to feed their families. But for this nurse and lab technician that I spoke to, they're committed to staying here. They say, you know what, we give 100%, but now we have to give 200%, and we're gonna make this work for the patients who come here needing healthcare services.